Hi everyone, my name is Christian Bullock and I work as a digital campaign architect for Gryt Health. I wanted to share a little bit about my story, my experience as a cancer patient, and then talk a little bit about why I do what I do at Gryt Health. So over 2 years ago I was diagnosed with blood cancer. It was Hodgkin lymphoma. And it was really scary for me because I know no one, uh, friends, family, acquaintances, etc., that has had cancer. So as I went through the process of getting a diagnosis, which I think if you've gone through a cancer diagnosis, you know that it can be a very long, drawn-out process. Um, Once I heard that I was diagnosed, it was a really scary point in my life. In fact, I that day got home and compiled every and all of my usernames and passwords just so my wife could have them. My kids could have access to my accounts. Weird stuff that you wouldn't think that you would want to do, getting a cancer diagnosis on the day of. But I was so frightened. I was so scared, and I had nothing to expect. I had no idea what was going to happen. And so, going through my chemotherapy experience and then my radiation as well, Gryt Health was there for me. At the time, it was connecting with other folks on the app, and it was really great to be able to talk to people that have gone through exactly what I was going through, to get an expectation of, okay, how is ABVD actually going to hit me? Because we can all go to Dr. Google, we can all search for that, and you can see all kinds of varying answers that people type out, whether it's on a website, on a forum, social media, etc. But to me, I've really embraced the power of having that one-on-one connection with somebody. And after I got through that diagnosis and all the treatment and moved into a survivorship phase, um, to me, when I kind of got that all clear from my oncologist, it was it wasn't a really happy experience, meaning, I didn't go out and start celebrating because you spent how many months actually fighting the disease that you're diagnosed with. You had chemotherapy, you had radiation, surgery before that, right? And then all of a sudden it stops, and you're kind of deemed, you're free of cancer. And it's one of those things where it took a while for me to kind of get back in the natural rhythm of things. So once I did get through that and work through that, I reached out to the Gryt Health Team because I wanted to give back. I wanted to be able to volunteer my time and help an organization that really helped me out. And thankfully, the Gryt Health Team was really accepting of that. And ever since then, a little over a year now, actually, I've been helping them. And really, my primary goal is to ensure that if there are patients out there that have been newly diagnosed or that are struggling through treatment or otherwise, there are caregivers out there with any questions that are also struggling with, how do I emotionally support, my partner or a family member or a friend, wherever it may be. I think there are all kinds of people with questions, and while it's so easy to find answers on the internet or at an actual institution like a cancer center, nothing beats the experience of actually talking to someone that has gone through exactly what you're seeking, what you're wanting to have the answers about. So my experience with Gryt Health is really trying to help get our company in front of people that would find it useful. And we've all seen the numbers of how cancer affects everybody and the number of people it affects. And there's all kinds of people that we really need to continue to try to get in front of because they're in need of that help, they're in need of that support. And I feel really honored and I'm really happy to be working with such a great, compassionate and loyal group of people that really our mission is to be able to do that. So that's my experience, and that's why I do what I do with Gryt Health.